Hello everyone, and welcome to PreteenVaxScene webinar series. Today we will be presenting on the HPV vaccination toolkit. Jill B. Rourke, lead for adolescent immunization communications for the National Center for Immunization and Respiratory Diseases, will be presenting today's session. The goal of today's session will be to share an overview of the new HPV vaccination partner toolkit. Jill will walk through the various features and resources of the toolkit aimed at establishing partner networks, sharing resources to increase community awareness, and assisting in efforts to motivate parents and clinicians to promote HPV vaccination. Before we get started, we wanted to review a few housekeeping items. Please note that if you have any webinar issues at any time, feel free to email preteenvaccine@porternovelli.com. For future viewing, the webinar will be recorded and available online at CDC's Health Streaming YouTube channel. All participants will be kept on a mute mode in order to reduce background noise. As such, please communicate any questions by writing them in the chat box in the corner of the webinar screen. Please be sure that when submitting a question, you direct it to the webinar staff by selecting this option on the drop-down menu of the chat box. The final portion of the webinar will be dedicated to answering questions, so if possible, please hold questions until the end. Selected questions will be read out loud for the presenter to answer. Thank you for your patience. At this time, I would like to introduce today's presenter, Jill Rourke.
Hi everyone, great to have you guys here with us. Happy New Year. This is the start of 2017's webinar series and we're really excited about that. And what I'm going to be sharing with you today is actually something that our communications team did in collaboration with the Immunization Services Division here at CDC, which I'm sure many of you are familiar with. And so we had been wanting to update the information that we had on HPV and HPV vaccination for our partners and the programs, whether you're an immunization program, a cancer prevention program, clinical specialist, whatever your role is, public health. We want to make sure that we have resources available to you in a place that's easy to get. And so I think right now you should be able to see my screen, and I have up the HPV portal for cdc.gov, and there's a couple of different ways you can get to this. You can go to cdc.gov and just type HPV in the search bar, or you can just, up at the top you can see it's cdc.gov/HPV. And once you're here, you can see that we have 3 separate blocks. We have for parents and the public, we have for healthcare professionals, and for partners and programs. And so today, what I'm going to do is go to the section for partners and programs. Now, you could just go to this to cdc.gov/HPV, which is the portal, and know what you want. You want to go and order materials, you could click right here. If you don't know what you want, or you're like me today doing a webinar on this, you can just go right into the toolkit and browse through everything that is available. So that's what I'm going to do today. I'm going to start by looking over the 3 main sections of the section of the toolkit that is primarily for partners, awardees, state programs, anyone that's doing outreach about HPV vaccination. All right, so whether you're at the state level, a local level, you're part of a national organization doing work on HPV vaccination, there should be things here that you can use. So we've broken the toolkit into 4 main sections: outreach to parents, outreach to clinicians, establishing partner networks, and our partner spotlights. And if you receive the PreteenVax newsletter that we send out about on a monthly basis, you'll be familiar with the partner spotlights. Those are the stories that we put in our newsletter, and they're going to be all collected here in this section. And you can read about those. We're going to be dividing them up by whether or not they're a program, a partner, or a clinician. And if you want to nominate someone for that, we're going to have information on how to do that. But let's start at the beginning. So no matter what kind of organization you are, you probably are trying to get information to parents about HPV vaccines. So we're going to go into the outreach for parents section. Now there's 2 different ways that you can navigate around this toolkit. And as you can see, I'll go back You can see when you're on the main page of the toolkit, I can click here in the middle of the page on one of the 4 sections, or I can go up here to the left-hand navigation. And you can see that we have the little plus signs, which means we can maximize the selection and open it up to the drop down and see all the different areas that are under here. So under outreach to parents, we have 4 different areas. So I go to outreach to parents. You can see we have materials for parents, ordering materials, and content syndication. I'm going to go through each one of these for you. All right, so materials for parents. These are going to be the things like our fact sheets. Could be fact sheets very basic about all the adolescent vaccines, specific fact sheets about HPV, the vaccine information. So here's what we have on here. I am not going to go to each one of these pages because it pretty much shows you what's on each one, but we have the schedules, and this includes the easy to read schedules. So not the version that we use for clinicians, but the version that we developed for parents. All of our fact sheets for all the adolescent vaccines, including HPV vaccine, including HPV vaccination safety, fact sheets and posters on those. We do have in one place, however, HPV-specific materials. Many of these materials are materials that would be good for clinicians to hand out in their practices to parents and patients. Of course, the vaccine information statement, sometimes those can be hard to find, so we've got them here for you. And then we have a large list of video and audio resources available, so those would be things like our PSAs that are either radio PSAs or video PSAs so they could run on TV. You can actually download these in their broadcast versions and give them to your local TV station to run on the local cable channels. We also have podcasts on here, so lots of different video and audio resources for you. All right, so we're going to go back, and we could go back in one of 2 ways. We can follow the breadcrumbs at the top, or we could go over here to the left-hand nav. So we're in outreach to parents, materials for parents, and I'm going to go next to ordering materials. And this is a question that we get all the time is, hey, I saw these great materials on your website. Now, how do I order them? And now we have a page that tells you exactly how to do that. And hopefully, this is going to be helpful to you. And so it tells you how to get to the CDC Info on Demand publications page. Once you're there, you're going to go to programs, select immunization and vaccines, teen, and then you're going to see a list of the things that you need. Now, we have some things in there that are really popular and go really fast. And so a lot of times people will say, hey, I was in there, but there aren't any available. You can actually email us directly to find out if we have any stock in house. And so the warehouse does not have unlimited space, and so we're constantly having to replenish it. So there might be some times when things have just run out of stock. In fact, today is the perfect example of that. So we just found out that we ran out of stock of the new tear pads that have the easy to read immunization schedule on one side for adolescents, and on the other side is the sort of planner for when to get your vaccines. And we, in 2 days, went through 700 sets of those tear pads. And so we're at a point right now where we've got some stock in house and we're going to be putting in an order to ship it there. But in the meantime, if you needed some, you could just email us and we could send them directly to you. All right, so that's ordering materials. All right, the other thing that we have under outreach for parents is web content for parents. And what's important about this is because you could just go to the section of our website that is web content for parents, but this is really about how you can display web content for parents about HPV vaccine that is coming from the CDC, and that's through content syndication. And if you haven't used content syndication before, it's a really helpful way to always have up-to-date information, whether it's about HPV vaccine or really any health topic at CDC. And it can go directly onto your page. And so we've got this great graphic here that shows that what you see on the CDC website can then be syndicated, and it can go to your website, whether that's on, people see that on a mobile device or on their desktop. And so there's actually a library of all of the different content that's available, and you can go through and choose that. And so here are all the things around HPV and cancer. And we actually, if you click here, you can actually go to the list and it tells you exactly how to step-by-step do that. We do recommend that you get your webmaster to do this for you because they might have to manipulate a little bit of the code to make it show up on your page correctly. We've actually been working with the state to make sure that that's happening correctly for them because they're about to launch a communications campaign, and it's going to launch with their program's website on it, but it's going to have up-to-date information. So as we update our website, it automatically is going to update on their website as well. All right, so as I said before, these were all the sections of outreach to parents. We went through materials for parents, we went through ordering materials, and we went through content syndication. All right, so again, we could use our left-hand nav or we could use the breadcrumbs. The breadcrumbs would take us back to the main page of the partner toolkit. We went through parents. Now we're going to do outreach to clinicians and see what we have available there. All right, so our section on reaching out to clinicians, there are a number of different organizations that are doing outreach to clinicians, whether it's a local medical society chapter. We've got groups like the American Cancer Society doing outreach directly to clinicians. The state health department's doing direct outreach to clinicians. And so here should be all the things that you could possibly use when reaching out to clinicians for HPV vaccination. Now, as I go through this, if you happen to notice that you feel like something's missing, or we have a resource and we don't have it linked here, or there's a resource you'd like to see, please make note of that and let us know, and we can talk about that during the question and answer section. All right, so let's go through outreach to clinicians. So understanding HPV vaccination coverage. All right, so we have a number of different resources for that. Some are really specific and some are a little bit more general. The first is HPV vaccination coverage data, and this is the new page. It's called TeenVaxView. There's one of these for each one of the surveys that are done to collect coverage data about the different vaccines given during different times of life. So we have Child VaxView, School VaxView, Teen VaxView, Adult VaxView. I even think flu might have their own. So you can go directly to TeenVaxView and look up the HPV vaccination coverage data. And what's so exciting about this page, and I can actually show it to you because we're live here, is that there are all these different ways to look at the information. So maybe you really don't need to look at the actual data. You just want to see what MMWR articles are available. You can go to that. If you want to know where we get our information from, because you're going to be writing a paper, you can go to our data sources. You can actually see the objectives, targets, and indicators that are set around the coverage data. And then TeenVaxView Interactive, that's actually where you go to get the very specific data. Now, we have left the toolkit to go to this page. And so you can see that on the left-hand side there, it's not the same navigation it was. So this is one of those times that you're going to have to use the back button to get back to where we were, which is under understanding HPV vaccination coverage. All right, so there's one. Next, NIS Teen, and this is just details about the National Immunization Survey Teen that does coverage of just adolescent immunization. And so you could go there. We have a link to the President's Cancer Panel report. This is not part of CDC, and you can see it's got that little arrow in the box there telling you you're actually going to go off-site. But the President's Cancer Panel report has information. This was produced in 2014, and it's information that was collected about sort of the lack of acceleration of increasing HPV vaccination coverage. So really an urgency to improve coverage, and that's what that's about. And it really sets the tone for all the work that we do. And so, if you're new to HPV vaccination outreach and you want to know what your organization should be doing first, I always suggest the President's Cancer Panel report is a good place to start to know kind of where we are, what goals we want to achieve, what objectives under those goals, and how we're going to set out doing it. One of the first things that people always talk to me about is, should we be doing outreach directly to teens? So the President's Cancer Panel report is going to tell you why that is not the first target audience that we seek. And so it really lays out sort of the overall national strategy for how we're improving HPV vaccination coverage. Healthy People 2020, this is going to take you right to the section that's about adolescent vaccination and what the goals are that hopefully we're going to reach in the next 3 years. We can all cross our fingers and hope we get there and work really hard. And then the community guide has some really fantastic resources around increasing vaccination coverage. And this isn't just around adolescent, but it covers things that really run the gamut of things within immunization, then also some specific vaccines as well. All right, so this is all under coverage and outreach to clinicians. Next, under outreach to clinicians, I'm going to go to quality improvement. And remember, as I said before, on that, we can use the left-hand nav to navigate, or we can go back to the main and navigate from there. We just did understanding HPV coverage. I can click here for quality improvement or click over here. Either way, it's going to take us to the same place. All right, so we've got quality improvement and evidence-based interventions. And so when doing outreach to clinicians, one of the things that we're encouraging is to do quality improvement projects to increase HPV vaccination rates at the practice level or group level or health system level. And so this is the information about that that you can use when doing outreach to clinicians. So one is about AFIX visits, and so it's all the information, and we actually have a descriptive page here, so this doesn't go directly to the AFIX site right away, but it actually talks about what AFIX is, and then got some information here about AFIX, how to get to the AFIX website, and then we also have a webinar that was done by Dr. Melissa Gilkey, and specifically on AFIX, and you can get to it right from here. All right, so now I'm going to go back to the rest of the quality improvement. Immunization information systems information, so IIS. Wow, that's information twice in the same line. It's kind of complicated, but I think you guys understand. So IIS, all the information you could ever need there about registries and surveillance programs. We have information about reminder recall. So lots of really good things here on ways to improve reminder and recall systems. And then we have some really specific things, quality improvement projects targeting immunization. And so if you have someone who's trying to do an immunization or HPV vaccination quality improvement project, here are all the different things that they can go and look at. So AFIX, we've got the state-by-state quality improvement programs. There's an immunization toolkit called the 4 Pillars that was done by University of Pittsburgh. It's got a maintenance of certification project available. And as you can see, there's one from AAP. They also have an MOC, but they've also got EQUIP, which gives them all kinds of tools. So different things here that people can use in terms of very specific immunization quality improvement projects. If you know of a quality improvement project framework that you would like to have added to this, let us know, or an example of a specific HPV vaccination maintenance and certification program, let us know, and we can add it to this. All right. So now I'm going to go back to our page, and this was another one where it went outside of the toolkit, so we're going to have to use the back button in order to get back to everything. Now we've got multiple resources. If you need survivor speakers, so people who have survived or been a caregiver with someone with an HPV related cancer, we have a list for speakers in their area, or you can go and look at the survivor videos. This is something that providers and partner organizations could use. We have a way to get clinician speakers, so if you want a specialist or a pediatrician who does a lot of work in HPV vaccination to come speak at grand rounds, this is how you would get to that information. And then if you want to be a HPV vaccine champion yourself or do speaking, we've got resources for that. So you click here and get to those resources. So things like talking points and our You Are the Key slide presentation, things like that. All right, now back to Outreach for Clinicians. The 4th section here in Outreach to Clinicians is clinician resources. And we have a number of different resources for clinicians specifically. And again, this is set up to be, if you're doing outreach to clinicians, they actually have their own site on the HPV portal, and I'll walk back in a little bit and show that to you. But if you're doing outreach to clinicians, this is where you can go to find all those resources for them. So this is really set up for you. So we've got a page of continuing education courses, some of them from CDC, some of them from Medscape. We have a page with all of the PreteenVaxScene webinars that have already been uploaded to the YouTube site, and we always get questions about this. When we do a webinar like we're doing today, it gets recorded, and then that recording may have to be edited. We make sure that it's clear and all that, and then it has to go be prepped for Section 508 compliance to make sure that it's accessible by people who might be using accessibility technology while they're on the web. And then it has to go and get cleared, and so sometimes it takes us 2, 3, 4, 5 weeks sometimes to get these up. And so if you're waiting for one to get up, we promise it will get there. It just may take us a little bit of time. So just please be sure to check back here, and then we also always send it out in our newsletter and let you know. All right, we also have a page of fact sheets for clinicians, and you may not recognize this thumbnail here, but this is actually of our new tip sheet. So I'm actually going to go to this page the fact sheets for clinicians page. And you can see the various fact sheets that we have. Now, not all of these have been updated yet to reflect 2-dose, which is why we have this little block up here reminding everyone that 11 and 12-year-olds will only need 2 doses of HPV vaccine as long as they've gotten those at least 5 months apart. So information about that here. But most of these have been updated, and we have the brand new tips and time savers for talking with parents about HPV vaccine. And it looks a little bit different. So, every year we go through a system of getting feedback. There are various groups such as UNC Chapel Hill doing research on things like the tip sheet, and they give us feedback, and so we take that feedback and incorporate it. And so what we have here is our newest, latest, and greatest version of the tip sheet. So this is the tip sheet that used to be tips and time savers, and hopefully this is going to be easier for clinicians to use now. All right, and again, now this is the one time we've opened a PDF, so it's actually opened it in a separate window, so we don't actually have to use the back button. We can just go right over to the tab that has everything on there. So this was the page of all of the different fact sheets for clinicians. All right, so I'm going to go back here, back to our clinician resources. All right, so in addition to sort of the educational fact sheets specifically for clinician to educate themselves about all things HPV vaccine, we have some resources that can be used in a practice or a clinic setting. So these would be things like our infographics, our posters. Sometimes people have TVs in their waiting rooms, and so they may want to play a video. If you haven't used this yet, this is actually really great. We have a section here on hold messages. So, when I call my pediatrician's office and I'm waiting on hold for the nurse to get back to me, I get to hear messages about various health topics. And so we actually have some of those written scripts that you can use and have someone record and put on a practice or clinic hold line. So while they're on hold, they're hearing stuff about adolescent and other HPV vaccines. So very exciting. So if you're not part of it, if a clinician isn't part of the service, or if your practice isn't part of it, they can actually record their own. All right, so I'm going to go back. So we're still here in clinician resources. So we had practice and clinic resources, and now we have fact sheets for parents. So we had fact sheets to educate clinicians themselves. We have resources that you can hang in the clinic or use in the clinic, and then we have fact sheets that are very specific for parents and for patients. And so those are all here, and many of these are going to be things that you've seen before and that we have recently updated. All right, and then we have some links to outside resources, such as the American Academy of Pediatrics HPV Champion Toolkit. If you haven't had a chance to look at this yet, I highly recommend it. Great resource. We have another link for maintenance of service, maintenance of certification activities for AAP member physicians. We have a page from AAP, also the community of immunizers, so more educational modules for clinicians. Suggestions for improving your immunization services. Say that you're not ready to take on a big quality improvement project, or you're a partner organization that's working with various practices or groups in town and they're not ready for quality improvement projects yet. You can actually start them off with something like suggestions for improving your immunization services. The American Cancer Society has a clearinghouse of all the different resources that have been compiled to help people improve HPV vaccination rates, and there's patient and provider education tools, and that's all of those resources are there in one place in their clearinghouse. 2 of those resources are on this page as well, and that is the ACS Just the Facts handout. So this is a helpful fact sheet about HPV vaccination facts, and it's got lots of information and talking points. And then also steps for increasing HPV vaccination in practice. So these are evidence-based strategies for clinicians to use to improve their HPV vaccination coverage rates. All right, so those are all the things that we had listed under clinician resources. So as you can see here, we'll minimize that. And next was establishing partner networks. All right, we have 3 main sections here on establishing partner networks, and this is one of the big strategies that we actually have for improving coverage nationally. I think everybody on the phone knows that one of the things that's a little bit different about HPV vaccination is that there is no one silver bullet to improve coverage across the country. It's going to take a lot of different interventions at different levels is going to have to be done to improve HPV vaccination. And one of the best ways to do that is by bringing stakeholders from various parts of HPV vaccination and cancer prevention together to work together in these partner networks so that everybody can share the resources that they have. And so one of the things that we recommend is engaging stakeholders at the local level. So how do you bring together partners at the local level? And so one of the best ways to do that is to know who's available. So there's this fantastic contact directory that was put together that has numerous programs and organizations by state that may already have some HPV projects going on in your area. And so this is a tremendous resource to find out what is already going on. We have links to all of the chapters of the American Academy of Pediatrics, as well as, you can see here, lots of different partner groups, American Pediatric Association, NACHO, the National AHEC organization, which are the Area Health Education Centers, the NCI designated cancer centers, as well as down here, the Association of American Cancer Institutes, which is all the cancer institutes, the NCI designated and the ones that are not NCI designated, and then also American Cancer Society. So lots of different opportunities here to bring stakeholders together to work together. And this is where you're going to find all their contact information. So if you've said, you know, we've got this group of people that are getting together, you know, on a quarterly basis to talk about reducing HPV cancer in our area, and one of the ways we want to do that is for HPV vaccination, but we just haven't brought family practice to the table, or we just haven't brought you know, our city health officials to the table yet. Well, here's all your contact information on how to do that. All right, so under establishing partner networks, so we had three main areas. One was engaging local partners, and I've showed you how to get to all that. The next is developing roundtables. So some areas already have things like this established and others haven't established them yet. But essentially, as I said before, you know, we're going to improve best if we work together to make these improvements. And so one of the ways to do that is to establish some kind of coalition or roundtable. And a lot of groups have immunization coalitions, but they may not be focused on adolescent immunization or even very specifically on the issues surrounding HPV vaccine. And so there's ways we can bring together all those folks that we mentioned on the previous page. And so this is a step-by-step how to do that. If you want to start a group in your local area, you know, you've met with stakeholders, you realize altogether that there's nobody coming together to talk about this. You know, there's a focus on, say, adult vaccination or flu or childhood, but there's really no one focused on just HPV vaccination. So we have steps here on what to do, how to prioritize, and we've got the steps on how to do that. Then how to establish that group of partners as a roundtable, coalition, whatever you decide to call it, how to do action planning, so actually walking through how to do SMART objectives, and then how do you maintain that group? And once you've come together and you've gotten a lot of excitement and maybe you produce some things, how do you maintain the group and the activity? So 4 steps here, and you know, hopefully this is going to be a living website, and we're going to add more to this as we learn more about the ways that this works really well at a local level. So for now, if you want to start a group like that, or you're a group that's already formed that's kind of struggling, here are some things that have been proven to work. A lot of this came from the National Colorectal Cancer Roundtable and what they've done to establish groups at state and local levels. So these are evidence-based things that have really worked. All right, so now I'm going to go to collaboration spaces, and some of you may have heard of these before. We have all kinds of things on the CDC website. Amazingly, we have a lot more that we don't put on the CDC website, and a lot of those things are going to be things like our digital ads, the print ads. So we'll have posters available, but we don't, you know, put online all of the different digital ads we use or all the different print ads. And we have a lot of different places that are doing their own communications campaigns. And so they ask us, well, you know, we saw that poster and we were wondering if you had anything like that we could use as an ad. Well, we do have a lot of those ads available. And so what you have to do is you can go here to CDC's creative collaboration space and go in and actually look to see what we have available. Now, if you do not have a cdc.gov email address, you're actually going to have to ask us for access. And so right here, you can just send an email to PreteenVaxCines@cdc.gov. We'll get you access. It'll give you a username and a password, and then you can go in and use whatever you'd like. And so it makes it really easy to get to that sort of wealth of items that aren't necessarily the kinds of things we put on the website, but definitely want to make available to folks. So it's essentially like a members only portal to get into. You just have to ask us for access. If you're in a state health department and you've got a CDC PHA working with you, they will have access to this automatically. And so you can work with them or you can get your own access. All right, and the other collaboration space that we think is really fantastic is NCI's Research to Reality. And what's great about this collaboration space is it actually has an area specific to HPV vaccination. So you can actually sign up to become part of that community within Research to Reality. And I encourage you to do that. All right, so we just went through the three sections on establishing partner networks. You can see that we've got over here, what can we do? And this is just a really simple one-page document that is the answer to when people say to us, well, what can we do? We are a cancer center that's not NCI designated. What can we possibly do? And so we actually have it for a number of different groups, actions that you can take, whether you do that as part of a roundtable or separately. These are actions that you can take to make a difference in HPV vaccination coverage. And you can also look to see what it is specific partners can bring to the table. I mean, there might be groups that you hadn't realized could bring something to the table that you're missing. And so this is also kind of a good cheat sheet in terms of what do people have to offer. All right, so next I'm going to go to the partner spotlights. We only have a few on here right now. We're in the process of going and adding all of our previous ones to this, and then going forward, every time we have a partner spotlight in a newsletter, we'll add to that. Right now we just have them all in one list, but soon you're going to be able to click through tabs that will say partners, programs, and providers. And so if you're looking for information on, how are clinicians like me doing this? Or hey, how does the average clinician improve their HPV vaccination rates without any funding? We've actually got two great spotlights that we're going to be putting up about that, clinicians who've been able to do that. So just some really good concrete examples of ways that state programs, partner organizations, and clinicians have been able to do work around HPV vaccination coverage. All right, and I said earlier that I was going to go back to our main HPV portal and show you the other two sections. So we just went through the toolkit, which is here under the partner and program section. And in saying this, I realized that nowhere on this page do we see that the HPV vaccination toolkit is actually what this is here. So I'm going to make sure that we do that for you. The other two sections that are on the HPV portal are for parents and the public, and then for healthcare professionals. And so if you are working with a health system or a practice or a group, you can send healthcare professionals directly to this section here, and they can get all the information that they need. If you are an outreach organization that's reaching out to parents and you want a simple website that you can direct parents to about HPV information that is specifically for parents and the public, you can send them here. Really basic, just 5 sections, but it leads deeper into CDC. I think many of you know that HPV infection and cancer and disease and vaccination and safety are at different areas of CDC. And so this puts all of it at a parent's fingertips to be able to get to all that information without having to search through CDC's website. So those are the 3 sections of the portal. And again, under partners and programs is where we have the HPV vaccination toolkit. So I'm going to pause there, and I'm going to turn to Sarah and find out if we have anybody who's already submitted questions. If you've had some questions pop up while I've been talking, please go ahead and go and submit those in the chat box. You can actually send them directly. You don't have to send them to everybody who's on the webinar right now, but you can designate those specifically to the organizers, to CDC preteen vaccine webinars, and go ahead and put your questions in. Sarah, do we have any yet?
Hey Jill, yes we do. The very first question that's come up actually a few times since you've been presenting is about the various languages that materials are available in.
Sure, absolutely. For our clinicians, everything that we have online that is outreach to clinicians is all in English. We do have a few select materials that are in Spanish that we actually created for Puerto Rico, specifically via immunizations mostly done by nurses in Puerto Rico, and they asked for materials that were in Spanish, so we do have some available for clinicians. For parents, we have materials in both English and in Spanish, and then we also have materials that were created specifically for American Indian populations. If you're looking for materials that are in other languages, I recommend that you go to the Immunization Action Coalition's website, and they have a ton of basic materials in many different languages. So they don't have necessarily the, they're not going to have super specific things about, like, say, HPV vaccine safety. They won't have like an entire set of materials on that, but they are going to have materials about HPV vaccine in various languages. So they're a great resource, especially if you have like an obscure language need.
Awesome. And we have another question about can provider or health department branding be added to the clinician resources?
That's a great question. So if you are a health department or a public health clinic, when you look at our resources, so I'm going to actually go and show you some now. We'll go to our fact sheets for parents, and I'll pull up our basic HPV vaccine for parents and go to the printer-friendly version here. You look right here and you see this box and it says distributed by. That was actually specifically created so that a health department or a clinic could put their logo or information in here, so vaccination clinics held on Mondays and Wednesdays from noon to 5, but they can put their information here. So yes, you can add, information. If you're distributing this material, add your information in here in this distributed by box. And that was created specifically for state and local programs.
And Jill, we have a question from Myra about does the CDC have any clinical education materials for dental providers regarding HPV and oropharyngeal cancer?
So actually just been in a discussion with our friends both in the Division of STD Prevention as well as the Division of Cancer Prevention and Control to update some materials around oropharyngeal cancer caused by HPV. There is actually web content right now, but we don't have an actual fact sheet. So one of the things that we recommend for dentists is actually just to use the general information that we have about HPV. So like this HPV vaccine for preteens and teens would be the perfect thing that a dentist could use in their office to say, hey, HPV sometimes causes, or oropharyngeal sometimes can be caused by HPV infection. If your kids don't get HPV infection, then we know that that's one way they can be protected from oropharyngeal cancer. Here's some information about the vaccine. So it doesn't have to necessarily be something specifically designed for dentists, because we want dentists to be giving parents the same information that a pediatrician or a family practice doc or a public health clinic or a pharmacist, make sure everyone is using the same information. So this would be actually a perfect resource, the basic HPV vaccine fact sheet for preteens and teens. And it's a one-sided fact sheet. If you order it from the warehouse, it's actually English on the front and Spanish on the back. There is a more in-depth fact sheet. So if you're in a community that has typically high vaccine exemption rates, or maybe has had, is known to have parents that are looking for more information, high information seeking parents, this is a great fact sheet for that. It's a two-sided, front and back, and it has more detailed information about HPV disease and HPV vaccine. And then on the back of it, it actually has a story from a cervical cancer survivor. So that's usually, this is the kind of thing we would give to a parent who's seeking more information. So those are both really good options for anyone who is trying to educate parents about HPV vaccine.
Jill, we have a question from Shelley. Is there any social media materials like the website library or Facebook or Twitter available?
Sure. So we actually do have a social media bank, and if you would like to receive that, you can email us at PreteenVaxCines@cdc.gov, and we can provide you with that. We actually have been talking about creating an actual document, like PDF document, and making it available through the collaboration space. We also encourage you to follow the Twitter accounts at CDC and Facebook and repost things that we've posted. Highly encourage you to do that as well. More questions?
Yes, another question. We have another question about maybe you could repeat one more time where the resources are with multiple languages.
Oh yeah, sure, absolutely. So as I said before, our resources, you can see it on this page here, primarily come in English and Spanish, and then we do have very specific materials that were designed for American Indian communities. We have both fact sheets and posters for that community. If you were looking for fact sheets in other languages, especially if it's a more obscure language, recommend that you go to the Immunization Action Coalition website. And I'm almost positive, and we'll look it up right now together, that they are immunize.org. I hope I'm right. Nope, wrong page. Sorry for that. I'm close. Immunize.org. Yes, Immunization Action Coalition. So immunize.org. And they have information that is in various languages.
Okay, we have another question regarding when they're trying to help their clients accept the vaccine. They've noted that true stories really help. Are there any true stories that we can send them to?
Yeah, so we actually have multiple options for that. So one, as I mentioned before, we have a handout that has a survivor story on the back. We have, I mentioned before, the clinician resources. We have PSAs, so there we have our own survivors, and then the American Cancer Society has a list of videos that were done by HPV cancer survivors and caregivers and clinicians. So some really fantastic stories there, and highly recommend that. There's a number of different organizations, and we'll make a note right now. My team is furiously scribbling this down as I say it. Make a note that HPV cancer stories, that will make a page that has links to all the different organizations that have this available, because there are 3 different really good places that you can go to get those.
Excellent, thank you for that. It seems that we're having some technical difficulties with the collaboration space registration form, so maybe we can note that we'll look on the back end of that.
Sure. If you're having trouble, if you're not able to get onto that, you can always just send us an email to PreteenVaxCines@cdc.gov and say, I would like access to the collaboration space. So in fact, if there's ever a problem with the website at all, we encourage you, please email us, PreteenVaxCines@cdc.gov, and just let us know that there's an issue with it, and we'll try and get that fixed. And the same thing, if you find a resource that you think is really terrific, so let us know so that we can link to that resource as well. Because really this toolkit is your toolkit.
Jill, we have another question about where people can find information specifically for safety.
Oh, HPV vaccine safety? Sure, absolutely. So we'll just keep going back to this one page a lot, I'm sure. Fact sheets for parents, materials to give parents. Actually, the first 2 listed on here are our HPV vaccine safety fact sheets, because we get asked for them a lot. There's 2 versions of this fact sheet. And it's very obvious once you open up the fact sheet and look at them. One of them has a very long list of citations, and the other one doesn't. One is just super simple, and one has much more in-depth information. So again, depending on the parents information seeking. Like if mom says, well, you know, I really like to be able to do my own research, which we know she means search online, the fact sheet that has all the links, and it's linked to each one of the citations, would be a great one to either give the mom the link to that or hand it to her in hard copy. But either way, you know, a mom that wants to look things up, she can look up the studies. And so there's actually a list of studies available about HPV vaccine safety on that fact sheet. And then the other one is the simple fact sheet. But both of these on materials to give parents under the clinician resources. And then also, if you can actually get to that from the parent website as well. So we have a way that if parents are on our website already looking at information about HPV vaccine, they're going to get to a page that has this information for them as well.
Okay, and our next question comes from Mrs. Torres. Her comment is that there are resources, she sees resources for parents and teens, but have resources or tools been developed for young adults and special populations like the immunocompromised, HIV positive, transgender, and if yes, where can they be found or accessed?
Sure. So the majority of our materials are for parents because the recommendation for HPV vaccine is at 11 or 12. And so that's really where our focus is at 11 and 12, getting kids vaccinated long before they're going to be exposed to HPV infection. So that is the reason for why our materials are focused there. There are other organizations that are creating materials for special populations. The CDC's STD website actually has a lot of information for young adults. So there's fact sheets for young women and young men, and they have tremendous resources for not the teen and preteen community, but actually young adult community across the spectrum of various sexually transmitted infections. But that is also very separate from the vaccination information that we have here for parents of 11 and 12-year-olds primarily. So most of those are going to be, the difference is that these are going to concentrate on vaccine for the prevention of HPV cancers, and those are going to focus more on safer sex practices and reducing risk across the board and things like that.
Jill, we have a specific question about is there a simple handout documenting the decrease of HPV cancers in Australia with the rise of the vaccination rates? Do we have something to show parents about that?
Okay, so I'm sure we have that person's contact information because we're probably going to have to email this one because we actually don't have a link to this online, but this gives me an idea that probably we need to link to our references and publications page so that we have on our teen site right now. We can absolutely add that. That's a great suggestion. There is a paper that came out about the decrease of cervical precancers, and so we can link to those. And so it's not really in a fact sheet, but we do have a number of different studies that have come out, and they continue to come out, and that's one of the reasons why it's hard to create a fact sheet on like HPV vaccination impact, is because it's constantly changing, because you know, there's studies coming out all the time about it, which is really fantastic news for us. But yes, we can definitely provide a link and multiple links to various resources like that.
And Jill, we have a few questions regarding materials related to partnerships with schools, and what information we have available about that, as well as if we'd be interested in adding those resources to our website.
Yeah, absolutely. So probably the best resource, and we are in the process of updating this one and moving it to this site, is a letter that we created in collaboration with the National Association of School Nurses. And this is a letter that either school administrators or the public health nurse at the school can send home to parents of kids that are about to matriculate or graduate from 5th or 6th grade, depending on the age at which, or the grade that there are school requirements for vaccination. So say in the state of Georgia, that is 7th grade, at the end of 6th grade, the school administrators or the school nurse could send home this letter. And the letter basically says, you know, to keep your child, your 11 or 12-year-old healthy, 3 vaccines are recommended for them, plus a flu vaccine. So it's got them there, talks about HPV vaccine, it talks about meningococcal vaccine, HPV vaccine, Tdap vaccine. By the way, everybody 6 months and older, a flu vaccine every year. And then one of the final lines says, in our state of, and you can add to the template, Georgia, the following vaccines, Tdap and meningococcal vaccine, are required before 7th grade entry. And so instead of it being a letter that says, here are the 2 vaccines that are required for your child to come to school in the fall, it's here are the vaccines that are needed to keep your child healthy. And then, oh, and by the way, at the very bottom, here are the ones that are required for school entry in our state. So this was a project we did with National Association of School Nurses. And like I said, we are updating it right now. We're updating everything because of the change in the recommendation to 2 doses. So for 11 and 12-year-olds. And so, you know, we're just trying to get it all out there in time, but that is an excellent idea, and we will add that resource as well.
And Jill, our next question comes from Joy Taylor. She says, under Speakers Bureau, I do not see any list of names of speakers. And is that available, and how do we get to that?
So when you go to the Speakers Bureau section, it gives you contact information for the people that are managing, or the groups that are managing the speakers. And so essentially that's the way that it works. Instead of putting up contact information for the actual individual speakers themselves, there's someone managing that group. And so you would contact them, say, hey, you know, I live in this state. We are going to show someone you love. We'd like to have a panel afterwards, and we need a survivor. And they can help you find that.
So we have another question regarding if we have a list of states that are now requiring versus recommending HPV vaccine for school entry.
Let's see. Somewhere on our website, we actually have the link to the vaccination requirements. I will have to find that, but somewhere on the CDC's immunization site that is available. I can tell you that for HPV vaccine, I think it's only 2, and they have very generous opt-out policies, but it does list by state what the requirements are. And it's, you know, it's across the board for all school entry, all the vaccines that are needed for school entry in all the different states. So it's not a page specific to HPV vaccine. And actually, we're not the ones that maintain that. Somebody else maintains it. We just link to it.
Okay, and then our next question comes from Mrs. Wallace. She's saying, is there something similar like a fact sheet or an infographic available for showing the decrease in HPV cancers in the U.S.?
Oh, we do not have one of those right now, but I am definitely going to email my partners over in the Division of Cancer Prevention and Control and talk to them about creating that. That's a wonderful idea for an infographic.
We have another question regarding, it comes from a researcher, and she's asking, is there an approval process to go through to adapt and or translate materials into other languages or adapt for different uses?
Yeah, so the way that it works is basically any content that's on any one of our pages or any one of our fact sheets can be used. You can just copy and paste the content right off of it. What you can't use, say for instance, I'm going to open this HPV vaccine information sheet here, and you can see the young woman down at the bottom right. What you can't do is take her picture and make your own fact sheet with it. And that just has to do with how images are licensed. But you could absolutely, you know, take, you know, copy this, why does my child need this now, and put it in your own fact sheet, translate in other languages, use it as you need to. That is absolutely fine. You just, the other thing that you can't do is take this entire fact sheet and take the CDC logo off of it and put yours on instead. So in terms of we have some specific guidelines around co-branding and branding, and so if you have really specific questions about it, absolutely email us and we can direct you to the right person to answer your questions about that kind of thing. But for the most part, you know, if you've found the information on the CDC website, feel free to take that information and use it and translate it in your own materials. That is absolutely perfectly fine. Just ask that you Check back regularly to make sure that we don't have updates, because of course every time there's a change in a recommendation, or say we get the new NIS teen data or we get the new cancer data, we're going to have some different numbers. So be sure to check back if you do create your own materials. I mean, we love it when you use our materials and we try to make them as available as we can. Obviously we can't do that in multiple languages, but you know, happy to provide that data and information to you. Any more questions?
We did have a clarifying question about resources available in American Sign Language. Does the Immunization Action Coalition cover that as well?
That is an excellent question for which I do not have an answer. So one of two options. If you will email us, we can try and find out for you, or you can go to the contact page for Immunization Action Coalition, and they will get back to you about that.
And then we have another question from Miss Ann, and she was saying, do you have a current fact sheet in the graph or pyramid form showing the number of males or females affected every year with the different types of cancers from HPV?
So it is not super recently updated, but in the President's Cancer Panel report, there was a pyramid that was used that did have that information in it. So it had like oropharyngeal cancer, and it, you know, part of it was females and part of it was males. We no longer use that pyramid in our You Were the Key presentation, but the older version of it is available in the President's Cancer Panel report, which we link to. But, you know, I would say absolutely, if you can yourself or find someone industrious who wants to create that as a graphic for you, again, as the data changes from year to year, you know, so every year we get the United States Cancer Registry pulls statistics, and they average them over 5 years. And so each year we're going to publish data for a 5-year period average of cancers per year of HPV cancers. And so that data, it's usually not huge changes, but it's small changes. And so we always want to make sure that you've got the right numbers in there.
Okay, and that's, I think that wraps up all the questions.
All right, so I'm going to turn it back over to our assistants at Porter Novelli, who I believe are going to be providing you with an evaluation that you can fill out for us, and we really encourage you to do that.
Thank you again for joining us today. As a reminder, please feel free to email any outstanding questions to PreteenVaxScene@porternovelli.com. Once you exit the webinar, you will be brought to a screen and asked a series of evaluation questions. These questions are completely voluntary, and any answers will be used to inform and improve future webinars. We look forward to continued partnership and will be in touch about our next webinar in the near future.